recently passed their exam. Let us know when you do so we can give you a shout out. Other than that, let's keep working hard, keep studying hard, get to our questions. Question 1. Albert is a smart boy who enjoys helping the teacher at recess. His parents are concerned, however, that Albert is not making friends at school. If they wanted to use the Premack principle to target this behavior, how could they go about doing that? When looking at questions, terms should start jumping out at you. So immediately, Premack principle should jump out at you. And when you see a term, let's go ahead and define it in our head. So what is a Premack principle? The Premack principle says we're going to use engaging in a more preferred activity or response as a reinforcer for engaging in a less preferred response, also known as the response deprivation hypothesis. If we deprive you of something you want, okay, you're more likely to engage in the behavior we want to see. So if they want to use this Premack principle to target the behavior of not making friends at school, right? So assuming they want him to make more friends at school, how would they go about doing that? Well, we can assume since he enjoys helping the teacher at recess, that's going to be our reinforcer for trying to make friends at school in some fashion. Now that we've predicted our answer, let's get to the answer choices. A, reinforce Albert when he talks to peers while they are at the park on the weekend. Okay, sure, that might be great, right? When he's talking to friends, we want to increase that behavior, but this has nothing to do with the Premack principle, right? The Premack principle, given our information, is going to have to involve helping the teacher in some way. B, allow Albert to play with friends, but only after he helps his teacher. This is actually reversing the Premack, so be careful. Premack principle is you get to engage in what you enjoy doing. First, you have to do what we ask. Albert enjoys helping the teacher. He doesn't want to make friends, or he isn't making friends, we should say. B is just reversing that contingency, not what we're looking for. Albert is allowed to help the teacher if he engages in 3 conversations with peers at school. All right, here we go. Albert can do what he enjoys, helping the teacher, contingent upon trying to make friends or at least engaging in conversations with peers, a step towards making friends. C is the best way to implement the Premack principle. And then D, block all access to helping the teacher and prompt Albert to participate at recess. Well, blocking all access is going to reduce or remove his biggest reinforcer, might remove his biggest motivator. No indication that's going to actually help him make friends. If we want to use the Premack principle, we're going to use what Albert enjoys as a reinforcer as a consequence for making friends at school. C is our answer. A client with no history of regression has started to elope from the classroom. The teacher implements a response cost to target the elopement. Now the client has started hitting his peers. What might explain the client's behavior? What is the question asking? The question is asking about the client's behavior. And more specifically, the client has started to hit peers after this response cost has been implemented. A couple things here. First, very important, client has no history of regression. Second, the teacher implements a response cost. Well, what is a response cost? Remember, when we get these terms, we need to define them. A response cost is removing something in response to a behavior. It's a punishment procedure. Now, if we're implementing a punishment procedure, and all of a sudden, the client with no history of regression starts hitting his peers, what does this sound like to you? Does this sound like negative reinforcement? Well, we know the target behavior originally was elopement, right? Elopement isn't necessarily increasing as far as we know. Aggression is, so it's not really negative reinforcement because we're not negatively reinforcing this aggression. There's never been aggression before. Punishment-induced aggression. Yes, if there is a lack of history of aggression, a punishment procedure starts and aggression picks up, you can point to parsimoniously punishment-induced aggression. It seems like the simplest, most likely explanation. What about resistance to punishment? Well, the key between A and C is we don't actually know what's happening with the elopement, right? In order to understand if we're reinforcing or punishing the elopement, we would have to understand what is happening to the elopement, but we don't. All we know is aggression has increased, meaning punishment-induced aggression. And then D, spontaneous recovery, occurs after extinction. We're not putting anything on extinction here. We're punishing it. Can't be spontaneous recovery. Our best answer is going to be B, punishment-induced aggression. What is the most commonly used graph in applied behavior analysis? Very simple, straightforward question. This is more of a knowledge check more than anything. Okay, make sure you are understanding some of the basics. And if you don't know this off the top of your head, just think about if you're an RBT or you work with data, what do we use all the time? Well, we use line graphs, right? All the time we're using line graphs to chart trends, to chart levels. I'm always using line graphs. Standard acceleration charts, really reserved for things like precision teaching. We don't use them a lot. Withdrawal chart is not really a thing. We have withdrawal designs, okay? But remember, withdrawal designs, we're just using a line graph. And then a bar graph, occasionally, but like standard acceleration charts, you really only use bar graphs in specific situations. The most common graph used in applied behavior analysis is a line graph. You want to reduce the amount of times your client asks for a snack throughout the day. During baseline collection, the data shows a decreasing trend. What should you do? Let's break it down, right? What is the question asking about? That question wants to know, how are you going to respond to the situation where you want to reduce the amount of times your client asks for a snack? You're taking baseline. What is baseline? Data before intervention starts. And the data shows a decreasing trend. So what is the data doing? The data is decreasing. What do we want to see happen? Well, we want to see a reduction in the amount of times the client asks for a snack throughout the day. So if what we want to see is occurring in baseline, what do? Do we start to intervene? No, right? It's already occurring. Maybe something changed that we don't know. Just because we're not controlling it doesn't mean it's not doing what we want it to do. Perhaps the client mentalistically, quote unquote, matured. Perhaps some reinforcement occurred that we didn't know about. We're not sure. Either way, our goal is already occurring in baseline. Why intervene? So A, start to intervene immediately. Absolutely not. We have to keep taking baseline, hoping we see a continuing decreasing trend. Now, if that shifts and it starts to increase again, well, then we can start to look at intervention, right? B, continue taking baseline until the behavior increases. No, I mean, we're not hoping for an increase. We are already achieving our goal. Again, just because it wasn't us explicitly doesn't mean we're not achieving the goal. C, continue taking data and only intervene if necessary. Yes, absolutely. If your baseline data, one, is not stable, right? We're really looking for a stable trend, if in this case. Now, if we want to reduce something and that baseline is trending steadily upward, then of course, we're not going to wait forever. We're going to intervene at some point, right? But in this case, we're only going to take data, or we're going to take data and only intervene if necessary. And then D, stop collecting data. No, you want to continue taking baseline for a reasonable amount of time to make sure this is a actual trend and not just an anomaly. So what are we going to do? We're going to continue taking data, only intervene if necessary. A multiple baseline design is typically conducted across 3 or more of something simultaneously, which can include all of the following except what? Don't let the wording confuse you too much, right? It's a very basic question. A multiple baseline design, typically conducted across 3 or more of something, and that's really the key, simultaneously, which include all the following except what? What conditions do we usually conduct baseline designs across? Well, we have behaviors, right? We have participants, and we have settings. We don't use a multiple baseline design to compare treatments, okay? We're using this multiple baseline design to see how that treatment affects different behaviors. We want to see how it affects different participants, and we want to see how it affects different settings, okay? So we're not using a multiple baseline design across treatments, right? Only behaviors, participants, or settings. Pretty easy, straightforward question. And what you'll find is the test is long, 185 questions. There's going to be a lot of easy questions on the test, okay? Not every question is the hardest question you're encountering. When you get an easy question, trust yourself, don't overthink it, pick the best answer. Simple as that. You want your client to label dog. You put out 3 cards, 1 picture of a dog and 2 pictures of other unknown animals. You switch the unknown animal each trial, but keep the dog. What type of trials are you running? Let's break it down, okay? This is a discrete trial type of teaching. You want your client to label dog, okay? So we haven't taught it yet, so we can eliminate maintenance. You put out 3 cards, 1 of your target, right, the dog, 2 of other unknown animals, okay, unknown animals. And you switch the unknown animals each trial, but keep the dog. So is this naturalistic teaching? Clearly not naturalistic. It's very contrived, right? It's discrete trial training, the letter of the law. It's not maintenance because we haven't taught it yet. We're still learning it. These are going to be distractor or random rotation. Well, random rotation is the idea of changing targets out, right? Which we're not doing, okay? We're trying to teach dog each time. What we're doing is switching out the other stimuli. Trying to do what? Trying to distract them. These are known as distractor trials. We're taking unknown stimuli, trying to teach a known stimuli, switching them out each time. What type of trial are you running? A distractor trial. Jan, a BCBA, asked her RBT to assist with an assessment. Jan tells her RBT to intentionally deliver attention when the client engages in maladaptive behavior. Jan is most likely conducting what type of assessment? All right, we're looking at Jan's behavior, right? What does Jan do? She asks her RBT to assist with an assessment. We know she's doing an assessment. The question is asking about the assessment. Jan tells her RBT to intentionally deliver attention whenever the client engages in maladaptive behavior. Interesting. So we're manipulating, right, consequences, and we're intentionally reinforcing or attempting to reinforce this behavior. If you're entering different conditions where contingent on behavior, you're delivering whatever that behavior is trying to achieve, okay, what is that typically called? Well, it's not an indirect assessment, right? It's very direct. Indirect means we're not observing the client, which we clearly are. It is a direct assessment, okay, but is there a better answer, right? That's what we're looking for. We're looking for the best answer. Anything when we're working with the client is considered a direct answer. But what type of assessment is this specifically? Well, it's going to be a functional analysis, right? If Jan is intentionally delivering the function of the maladaptive behavior in an attempt to see if it changes the behavior, we're conducting a functional analysis, right? We have our different conditions, the best way to determine the function. This is what you have to be careful, and you have to read all of your answer choices. Is it a direct assessment? Sure, right? But most assessments are direct. The better answer is a functional analysis. Well, you might say, well, both are correct. There's going to be some questions on the exam where you might feel both are correct. In that situation, there is a better answer. You need to find the better answer. That involves patience. It involves taking your time. It involves being thorough, meaning read all of your answer choices, understand what the question is asking, and trust your preparation. In this case, Jan is conducting a functional analysis. Each morning you make oatmeal. You're trying to find the perfect amount of time to leave the oatmeal in the microwave. What might you do? All right. This is pretty clearly a comparative, component, parametric question. We have to start understanding the difference between these three, okay, because it comes up a lot. They're very important ideas. What is a comparative analysis? Comparative analysis is when we're just comparing different interventions. It's not part of a package, okay? It's just different interventions one at a time. Component analysis, we actually have a package of interventions and we're comparing those within the package. That's the difference. A parametric analysis is we take a single intervention and we compare the amount. Okay. Again, comparative analysis, there's no package. We're just taking different interventions, comparing them. Component, there is a package and we're comparing interventions within the package. Parametric, we're taking a single intervention and comparing how much. In this case, what do we have? Well, we have oatmeal. We're trying to find the perfect amount of time to leave the oatmeal in the microwave. Well, how many quote unquote interventions do we have? One, right? We have one variable, oatmeal. And we want to find how much time is going to make the perfect oatmeal. Not comparative analysis. We're not comparing different interventions, right? Different procedures. It's not a component. We don't have a package, right? We have a simple one variable time affecting our oatmeal. We're trying to figure out how much. We're going to conduct a parametric analysis. A track star runs extremely fast. After looking at how fast the track star ran, the opposing coach says he doesn't believe the time. The Opposing coach is exercising what? Okay, these attitudes, right? What is this coach doing? Well, he's doubting what's going on, right? Opposing coach says there's no way that time could be right. The other coach says, well, it's data, right? It's observed, it's empirical. How can you doubt this? Well, this is what this attitude tells us to do. Doubt science, doubt findings, replicate, replicate, replicate. Opposing coach is not exercising selectionism, right? That's development, that's phylogeny, that's ontogeny, that's learning history, it's genetics. Not what we're talking about here. The opposing coach is exercising philosophical doubt. Just because the data says one thing, just because the findings say one thing, doesn't mean we stop questioning. The opposing coach is simply saying, I want to see that happen again. Empiricism. He's not exercising empiricism. If he was exercising empiricism, well, the observed time he would go with, right? And the determinism, he's not doubting this behavior happened for a reason. I'm sure the trackster was supposed to run fast at this point. He's doubting the outcome. He's doubting the results. He's doubting the data. The opposing coach is exercising philosophical doubt. And then finally, all of the following are procedures used to promote generalization except for what? When you see this promote generalization, think of those terms, those group of terms meant to help promote generalization, right? Things like general case study, multiple exemplars, train loosely, program common stimuli, indiscriminate contingencies, right? We need to know all these and we need to know what they are. If you do, this question is very easy, right? Because you know indiscriminable contingencies is a way to promote generalization. Multiple exemplars, way to promote generalization. And general case, way to promote generalization. Which one is not included in that is non-contingent reinforcers. When we're delivering reinforcement non-contingently, we're not actually reinforcing in a particular manner, right? In a particular setting, or for performing this behavior generalized, we're just reinforcing on a time schedule, okay? The other three are actual procedures used to promote generalization. Okay, thanks for watching. We'll be back next week with